न्यूयॉर्क एरिक एडम्स की क़यादत में सिटी इंतज़ामिया ने न्यूयॉर्क सिटी में पब्लिक सेफ्टी को यकीनी बनाने के सिलसिले में $485 मिलियन का ब्लूप्रिंट जारी कर दिया है। न्यूयॉर्क सिटी की फर्स्ट डेप्टी मेयर शीना राइट और कम्युनिटी तंजीम मैनअप के सरबराह और टास्क फोर्स के रुकन A.T मिचल्स ने सिटी हॉल में मीडिया राउंड टेबल में एथनिक एंड कम्युनिटी मीडिया को पब्लिक सेफ्टी के हवाले से मेयर एडम्स इंतज़ामिया की जामा प्लान की तफसीलात बयान की। ये प्लान, जिसको अ ब्लूप्रिंट फॉर कम्युनिटी सेफ्टी का नाम दिया गया है, को न्यूयॉर्क सिटी गन वायलेंस प्रिवेंशन टास्क फोर्स की कोऑर्डिनेशन के साथ रिलीज किया गया है। मीडिया राउंड टेबल से खिताब के दौरान डिप्टी मेयर शीना राइट और A.T मिचल्स का कहना था कि प्लान के तहत न्यूयॉर्क के 5 बोरोज में बेलमूम ताहम शहर के 6 पुलिस स्टेशन के दायरा इख्तियार में आने वाले इलाकों में गन वायलेंस के खात्मे और न्यूयॉर्कर्स की तर्ज जिंदगी में बेहतरी और फलाह बहबूद के लिए मिलियंस ऑफ डॉलर्स खर्च किए जाएंगे। डिप्टी मेयर शीना राइट और A.T मिचल्स ने प्रेस कॉन्फ्रेंस में गन वायलेंस के खात्मे के प्लान की तफसीलात कुछ यूं बयान की।
We walked into office that first month in January. We had the killing of police officers, and just month after month there were lots of shootings and killings. Young people, children. So we were certainly concerned as a city, and it was a priority of the mayor and this administration. While we have a great police enforcement apparatus and their strategies were being refined to deal with the issues, the mayor said very clearly that in order to address these issues, you have to get to the root cause and you have to go upstream. You have to get to any person before they actually have a gun in their hand and are willing to pull the trigger, and understand what are the challenges and what interventions need to be put in place so that you don't have a person with a gun in their hand to begin with. So that was our charge. The mayor asked every city agency to contribute to this effort. He said that prevention of gun violence is not just the sole domain of the New York City Police Department. It is also the domain of sanitation, of parks, of the Division of Youth and Community Development, of education, of economic development. And he charged every single agency to come up with ideas, suggestions, and solutions about what they needed to do to contribute to gun violence prevention. So in June of 2021, right, 2022,
Yeah,
2022, yeah, 2021, we were here, 2020, it's all running together. In June of 2022, he put A.T Mitchell and myself as co-chairs of a task force. Initially, we needed to get our own house in order, so we had every city agency come to the table, as I indicated, and we also invited others, nonprofits, other major stakeholders, to give their thoughts, and we came up with a framework. What was so interesting is that when we had those initial convenings with all of the agencies, and we asked them a simple question: what makes you feel safe? What are the things that you think your agency can contribute to public safety and preventing gun violence? And there were lots of great ideas. So we organize them in a real framework that is evidence-based, like these are evidence-based strategies. And they basically are the things that make a community well and healthy and whole. You need housing. You need opportunities to work and to decrease unemployment. You need to deal with mental health issues and have trauma-informed care. They're all of these things that together will make communities healthy. We also looked at data, and we understood that across 77 precincts in the city, 30 of them contribute to all of the gun violence in the city, basically. 6 of them contribute to 30% of the gun violence. So what we said is we're going to look at those 6 because we're going to get the most kind of bang for our buck if we focus on those. There are 4 in the Bronx and 2 in Brooklyn. So that's the first phase. The next phase will be the next set of precincts and the next set of precincts. So that's what we're rolling out today. After we as a city kind of really looked at what these strategies were, and we looked at the framework, which is in the blueprint, then we engaged community. And A.T can talk a bit about what that engagement looked like and the thousands of people that we engaged to get their views as well. So where we are now and what the announcement is in execution and implementation full on. We have been doing work over time, but now it's full on. We've identified almost $500 million of resources that are going to be invested across these strategies in these neighborhoods and communities over the next several years. And we're expecting results. This is really about data. We're going to be measuring and monitoring how many units of housing have been built, how much employment is happening with young people, how much shooting, how much deaths by shootings are happening in these communities. All of those things are going to be carefully tracked and measured over time. And it's a plan. So we're going to be working on the ground in community, um, making sure that we're accountable for the results. And if we find that there are things we should be doing differently, we're going to evolve and get better and better and better. So that gives you a little bit of an overview, and I'll certainly turn it to my partner, A.T. Mitchell, who will include all the things that I left out.
Well, good afternoon, all. As mentioned, my name is A.T. Mitchell. I'm the proud founder and executive officer for a community-based organization that is in Brooklyn, New York, entitled Man Up Incorporated. It's good to have the members of the press present this afternoon. This is also an opportunity for us to make sure that the verbiage, the understanding of your literature, your reporting is accurate. And so this is a good opportunity for us to talk out the details of this plan. Our mayor, and I've been around government now for close to 30 years, and this mayor is much different than the previous mayors. There's been a number of different task forces that have been formed over the years. I've certainly participated on a number of them. I was a member of a gun violence task force that was put together during Mayor Bloomberg's administration. The difference with this particular administration and this mayor is that this mayor, coming from which he came, from the community, and being a partner in this work before he was elected mayor, was very familiar with the work that was being done in the trenches of our cities. And as been mentioned, those top 30 precincts, this mayor is no stranger because he traveled abroad as borough president, as state senator. He helped funded this initiative and the work that was being done on the ground back when he was in the state senate. The difference that this mayor made with this task force was that he decided to elevate a member of the community to literally go out and find someone who is on the ground every single day and night, that's out there operating as an entity and kind of leading the charge on this issue of gun violence that he knew of for so long. I'm, again, about 30-year veteran in this work, and our mayor recognized that work over the years, the body of work, and I'm one of those architects that created the crisis management system that has been now part of the blueprint in gun violence. And he asked of me to not just be a member of the task force. He actually asked of me to co-chair this task force. That was unprecedented. And he put me alongside the best of this administration, at that time, Deputy Mayor Wright. And she's been elevated, as we all know, the first deputy, and he continued to keep that as the structural way that this task force will operate. And so he said, not only will I be a member, but I would literally co-chair alongside his first deputy mayor. And that all the other deputy mayors and all the other city agencies will have to come to our table and, as been mentioned, begin to create a solid think tank around the issue of gun violence. And that's exactly what took place. I am one, again, that comes from out of the neighborhoods where the issues are unfortunately happening all too often. So I'm very familiar with this issue. And when I had the opportunity to come into government and work alongside so many of the other members of the task force, it was a deal breaker, because a lot of the agencies that are charged with servicing the communities that we are targeting were having a difficult time understanding the issue and how do they get their resources to those neighborhoods. There's a number of millions of dollars, if not billions of dollars, if you add it up, that are given to each agency that is supposed to provide meaningful services for the entire city of New York, including these 30 neighborhoods and precincts that we have. But Historically, those resources have not been making its way to the ground. And I can tell you from being a Brownsvillian and an East New Yorker my whole life that it's been often time where we felt slighted and we felt deprived of the resources, the opportunities that this great city musters up every single year in its budget. And so now working alongside so many other members of the task force, speaking to them directly about how do we connect the dots? How do we stop working in silos? That's what this task force has done. And how do we become one united force? How do we become one united team? How do we commit ourselves to making sure that in those neighborhoods that are unfortunately that's dealing with the issue of gun violence is also, if you look at, like the mayor would say, GPS mapping, they're the same neighborhoods that's dealing with the unemployment. They're the same areas and communities that's dealing with the crime and the school issues and housing and healthcare. How do we make sure that those communities, we even the playing field? And so that was my job. I played that role. I represented the community at this table, and I was very proud to do so. I can tell you for over the last year, when we've met continuously, monthly, that the best part for me was when we all agreed unanimously to go into the communities, to actually go into the neighborhoods that we are targeting, and let's make sure that we are not missing a beat and that we were on point with our recommendations. And so we went on tour, so to speak. We went literally to the 6 precincts that are part of the first phase, and we held community convenings with community members. We put up our strategies and we had breakout rooms and sessions, and they would come back and report back and they would give us their feedback. We held youth town halls throughout the city in those same precincts. We wanted to make sure that this blueprint, this community safety plan, reflected every voice of New York. Those that are unfortunately disenfranchised and those that unfortunately historically have not had their voices heard before. They are a part of this blueprint. They are a part of this plan. And so I'm very confident in this phase, now that we've gotten past, it's been over a little over a year. Now comes the part where we go into implementation, because the communities that we have been targeting have been waiting all so long for these sorts of resources to come their way and to help them in their daily lives. And so we are all, we're kind of like psyched up as a team. We can't wait until the game clock begins, and that's now, to go back into those neighborhoods and begin the application part of this blueprint. I've said often that these are beautiful, very fine, put together booklets with pretty paper, but it would mean nothing if we don't apply these and make sure that these things are real. Those communities out there are waiting for us. They are counting on us for this administration to get it right, and we're very confident. And I think we are beginning to witness a decline as we're experiencing right now, a trend where crime in those categories are going down. And again, I want to take my hat off to this man for tackling and taking on public safety as his #1 issue. Previous mayors did not take it on as their priority, and they could not, because they did not relate. This mayor got it, and now he's working with all the stakeholders. We have a number of crisis management system organizations, cure violence organizations that operate on the ground, and we're working very closely with helping them build capacity and making sure that they have the adequate funding that they need to be able to keep their doors open and operated, so that those men and women that put their lives on the line as well go out there and do the great job to bring down crime together. So at the end of the year, at the end of the day, we can all celebrate the decrease in gun violence in the city. Then I'm glad to actually have a chance to talk with you all as well, because there's a part that the media plays as well in our united force. Thank you for being with us.
Thank you. And one thing I do want to say, I want to make sure everyone knows, is that gun violence is down, year over year, down 27%. And so we've made a lot of progress, and since we've been in this administration, and still they'll have work to do. So I just want to make sure that that point is made.
Thank you. So I want to make sure that everybody has a copy of the blueprint. So if not, Mahmoud has them in their bag. So we're going to start the Q&A portion of this conversation today. We're going to have one question per reporter, and we're going to go through the list on the order that it was the RSVP that we received. So let me just start with, do we have weekly Bengali Koshi man here today? I didn't see Koshi. No, he's not. I saw it. Okay, Radio Soleil, Rico Dupuy.
Hi, good afternoon.
Good afternoon.
I want to ask one question, but that has two parts. It's about immigrants, undocumented immigrants, as far as this blueprint is concerned. I want to look at them as both endurers and probably dispensers of violence, of gun violence. What do I mean by that? They can easily be, they could be an easy prey because of their unique special situation. They are threatened with violence, gun violence, and they know they have no recourse. So I'd like to know if an undocumented immigrant find himself in that situation, what are the tools that he has, or he has, whatever it is. That's one thing. But that's what's dispensers. And when I say undocumented immigrants, I'm talking about specifically the newly arrived ones. The situation, the economic situation they find themselves in may not be optimal. And in that sense, organized crime could easily find them as, we can easily, use these people, and based on the situation they find themselves in, and as this situation gets possibly out of hands, what can we do to discourage them or to offer them, opportunities, or to discourage them from considering this as a way to make it?
So thank you for the question. And I first want to say that certainly the newly arrived migrants that are coming, there has not been any uptick in crime or any particular issues as it relates to that specific population. And so I want that just to be clear. I mean, these are people that are fleeing very challenging situations, and they really just want to work and they want an opportunity. And so, as you said, their inability to work can lead to real serious challenges because people are trying to make a way for their families, like all of our ancestors have done, right? And who came to this city. And so really continuing to press the federal government to allow them to work. Every other wave of migrants that have come to New York City have been allowed to work, whether they're documented or undocumented. And what we also know is that this population, like many that have come before, are working, but on not kind of on a black market. And so they are there is a potential for exploitation, which we are monitoring and is a real challenge. And because, New York City is 40% immigrant population, undocumented, documented, ancestry, everything in the blueprint applies. So whether it's the early interventions in schools, where middle school and high school students are going to be engaged in more activities and programs so that they have more opportunities, or that's the crisis management system is going to be pushing in to make sure that they're discouraged from joining gangs because they are more vulnerable. And I think that's true. So, some of the other issues, as you know, are more challenging for undocumented families as it relates to access to benefits and, like housing, affordable housing and other benefits. And we're trying to work within the parameters, but, stretch and do as much as we can. Last year, we invested in making sure that undocumented families could get access to childcare, even though their status would prevent them to do that. So we put in resources in the budget to do that. So it is tricky and it is a challenge. But the number one thing we believe that will really help is the ability to work. That's what people came here to do. That's what they want to do. And with the resources, then they won't have to make these decisions about how am I going to feed my family. And people will do desperate things to feed their family. So I think that those are good points. So the continued pressure from everybody, electeds, media, community members, let the people work is what we really want to really join forces and make sure we communicate.
So just want to say, if you are interested in specific data, so please connect. We're going to connect later with Mahmoud or myself because we can provide that. So the next one, Norwood News, Silly Malone. Oh, right here.
Hi. Well, yeah, let me say that the crisis management system is a huge partner of this administration, and we've made the largest investment ever in those organizations because they are successful. They have proven results. What is critical for the success of those organizations and institutions is that you have credible messengers, that there are actually people that have been justice involved, and they are on the ground and making connections to people who are in justice involved to help move along a pathway, really with opportunity. That situation is very unfortunate. It has nothing to do with our blueprint. That person did not participate in any of the engagement of the work that we did, and it's very unfortunate. We're very disappointed that that occurred, and justice will be served, and certainly he's going to go through that process. But that is not that's rare, right? For that
Right.
group, for any group. I don't know that it's happened before, but there's going to be some bad apples in a bunch, whatever bunch it is. But I do want to stress that the crisis management system has been proven successful, and as a city, through our procurement process, we do vetting. Obviously, people who have been justice involved, who are leading those efforts, that's kind of a prerequisite. We want to make sure that people are credible, but there's obviously vetting, there's auditing that's done, with all the nonprofits that we work with. There's performance management systems that are in place to ensure that they're meeting their benchmarks and goals as well, and we'll continue to do that. You want to say anything?
I would just add, as the first deputy mayor mentioned, we've been right now in coexistence for over a decade here in New York City. And historically, since our inception, we have not experienced these sort of unfortunate circumstances. The overwhelming majority of the men and women of the crisis management system, although have been justice involved, have also now became legal tax-paying citizens of the city and contributors to the city, and have given back to the city in the issue of public safety. And I think that that should over sort of charge any blemish of a small incident that may take place. We can't, of course, take full responsibility of it, but as been mentioned, our vetting systems are in place, and we look forward to continue to strengthen them. Likewise.
With Latino, River Time.
You mentioned six neighborhoods. What can you share about those? Where are they located? What is the common element that's happening at those neighborhoods?
Sure. They're all in the blueprint. I know the 73rd and the 75th in Brooklyn. I'm not gonna know if they're
The 4-0, the 4-2, the 4-4, and the 4-7 in the Bronx.
right. And so the common elements are gun violence, right? They're the highest percentage of shootings and people getting shot. They're also the highest percentage of unemployment. They're the highest percentage of chronic absenteeism from school. They are, they rank high in terms of homelessness, all the bad things, unfortunately. And they're neighborhoods and communities that have had a lot of disinvestment over decades, right? There hasn't been an investment in parks and playgrounds, and other community facility spaces. So it's a direct correlation that neighborhoods and communities, that have had a level of disinvestment are the ones where there's the most challenges as it relates to gun violence and public safety. So those were just the top, right? The top of the list in terms of gun violence. But the other 24 are not good either, right? And so we're going to continue to work on those as well.
It's fair to say that they were abandoned.
They were abandoned by the city. I would say that they suffer from decades and decades of neglect. Absolutely.
Snatch Media, Sarah here.
Hi.
I appreciate the focus on early intervention, starting in elementary, middle school. But what about interventions for youth who are and if you ever heard of the Richmond model, that was a model to work with repeat offenders in the city of Richmond, California, to provide fellowship for them so that they're paid to return to their communities and work with who are potentially at risk, victims of gun violence, and also criminal. So, really works for the city of Richmond. Shortly after that program was initiated by Richmond City Council and paid for by the city. Gun violence shows the lowest in decades, which that's pretty sound, right? So I wonder if there's a similar initiative where they pay people to,
Absolutely.
going through these
Absolutely.
Well, as you may know or not, the crisis management system is, in fact, it's a partnership of the Cure Violence Global model that derives out of the city of Chicago, formerly known as Ceasefire Chicago. And I recall in the early days when we began, we did scour the country and the nation for models that we thought that would be applicable to the work that we know that needed to be done here in New York City. I believe we were vetted on that model as well. So it's a little vague, but there's a number of models that were across this country, but the Cure Violence Global model was the model that we felt most comfortable with here in New York to adopt, which is very similar to what you said. Whereas we, as mentioned, we literally scour our communities for members of the community that are credible messengers, men and women who, some of which have been there and done that themselves. And we asked them to come on to the other side of the fence and be a partner with us in reducing the gun violence in their communities. And they are paid. These folks are employed. They're given living wage, honorably respectful wages to become part of the ecosystem of public safety. And I think that has been one of the biggest game changers that I've experienced when rolling out the Cure Violence model in East New York, Brooklyn, for example. The mere fact that I can go to a gang member or a former gang member and ask him or her if they're willing to help us change the conditions of their neighborhood by first and foremost offering them a paid employed opportunity. And when they do agree, they come in, they are vetted, as mentioned, and then they are trained on the model, and we undergo countless hours of training, and after which, when they are trained and they're certified to do this work, they're deployed back into their very neighborhoods, and they use their influence, they use their knowledge of their community, their terrain, to help us get to the other individuals who are similarly out there involved in possibly, committing the next gun violence act. And our job has been to simply make contact, develop relationships of trust, to get them to come in, and then we create what we call risk reduction plans with these individuals, and then we begin to apply the services. And that's again where we're excited about this administration's partnership with the crisis management system and the other city agencies, because now we can prioritize those individuals and expedite them to the front of the line. We can literally have our city agency partners and the resources that they have from what we learn of these individuals and their needs, we can actually see these needs get met. So yes, there is employment opportunities. There are, that financial incentive to create, like I said, individuals now who this become their career. It's almost a career pathway that we've created. And now these individuals are tax-paying, law-abiding citizens.
how many more positions
And just to that point, and just because people are, if they're not familiar with the secure violence and crisis management system. So A.T. Mitchell is an extremely respected member of the community, as well as by the gang members and the people who are dealing with illicit activities. And when he talks to them and says, "This is what we need to be doing," there's a level of respect. If I come and say, how about this job or this opportunity, they're like, "She's a nice lady," but like, we're not listening to her. So that is the model. We put $86 million in our budget this year from the city in a network of the crisis management system, and really under AT's leadership, and really vetting and evaluating and ensuring that these were the right groups. And I don't know how many hundreds of people are employed.
Yeah, there's several,
across those.
almost 400 individuals, if
Right.
not more now, are employed in this particular system.
So that's part of the heart of the model.
Security media, carbon monies.
Hi.
So I just wanted to ask, for how long indicators are going to track and how that's going to inform the next.
It will be tracked as long as we're doing the work. And so part of the governance is that in every precinct, there's going to be a neighborhood safety alliance that is going to be comprised of neighborhood residents and stakeholders who are going to be looking at the plans for their neighborhood. So for instance, a plan in Brownsville will say, under community vitality, which is one of the priorities, like, we need to fix this park and that playground. So this group is going to be looking to say, you said you were going to do it by next April. It's March. It's 90% done, or it's 10% done. But there'll be a regular cadence where we'll be looking at progress against the goals that are set for each plan, and there's going to be accountability. And absolutely, we believe in continuous improvement. These plans and this alliance on the ground is going to be meeting regularly. And then at City Hall, in this very room, we're going to be meeting with every deputy mayor and commissioner that is responsible for the elements of the plan on a regular basis to look at progress against goals. And when we find, like, you know what, we thought this was going to work, it's not working, we're going to be focused on, well, what do we need to do differently in order to get the results that we're trying to get.
I would just add that this document is actually, it's a living document. And like I mentioned, no two plans of those neighborhoods will look alike, because they will be tailored specifically for those neighborhoods and those communities. Because as mentioned, the neighborhood safety alliances are on the ground, and they're going to be helping us understand that, the implementation of it. And so I would ask that the public would give us, understandably respectful time. Rome wasn't built in a day. As mentioned, these communities have suffered decades of disinvestment. And so we can't expect miracles to happen overnight. But I think at this stage, this administration's commitment to be bold enough to want to invest in those neighborhoods to make it again an even playing field, I think, is stellar. So it's something that we are hopeful that people, and I'm not trying to say that we're gonna pay attention to the KPIs, and we're monitoring every step of the way, and we're gonna learn from each phase so that the next phase gets better and better.
China Press. China Press. Yeah.
So just a question, you talk about long-term strategies in different communities, six communities in particular. But, the fact is, throughout the city, in all neighborhoods, you hear gunshots in the night or something. Just curious, is there a way for you guys to work with the police agencies to make them data available so that people, the public, can find out what happened the last night of those gunshots? If there's any, some actually, they actually help these guys who did this. If there's any statistics. Mostly people are covered in the dark. We don't think they heard that there's gunshots, they see citizen out, but there's no way to find out what happens if the police ever covers guns.
Right. Well, one of the things that we're very excited about is you've probably heard about ComStat, that the NYPD, they have this kind of performance management where they bring everybody in and they talk very, like you said, what happened on such and such a block, what happened with such and such a crime, and they grill them to understand what's happening and then what do they need to do about it. So last year, I think it was maybe it was earlier this year, the NYPD has rolled out community CompStat. Well, they will actually come to your community and they will invite community in and they will review all of the crime data that's happening, what happened, where are we with this investigation, as well as other community concerns where community residents can actually say, we need this, or we heard that, or so that has just rolled out, and that is a part of this blueprint to do exactly as you said, to really make sure that the community is aware and knowledgeable about what's going on, but also can bring information to the NYPD and other agencies about what's happening as it relates to crime in their communities.
And I would just add, I believe this is where the press is so vital and important in terms of reporting the accuracy of the crime. The reality of the matter is that crime is down, but the perception is different. And so we have to do a better job at talking about what's really happening. And the reality of it is that New York is safer. And in those neighborhoods, we are experiencing decreases in those categories, but it's not amplified through the media the way that it should. And I think that helps the common New Yorker understand that we actually are in a better place. And so we just need that to be understood as well.
African Wisdom Magazine, José or Sarina.
So, good afternoon, everybody. I really appreciate the job you are doing actually, but there's a concern on where we're at. About kids that are involved in smoking weed now. Little kids like 12, 11, even 10, see them with that smoke. So is there any way we can find out how we can make it at least illegal for those children to be getting those things? Because in my blog, I live in Gondor area. See the van in front of where the kids are. And they come there, I want them, they buy that thing from them, they give it to them. And you can't go and tell them that I don't have to sell to those people because they have a problem with them. The kids are buying it now, you see kids, they smoke, they disrespect, adults, old people, they start beating them up in the street. So I don't know if there is any way, anything that we can put in place that can help to slow the kids down from smoking that because they're affecting them. Please.
Well, it's illegal for underage to buy tobacco, just cigarettes, and so it certainly is illegal for them to be smoking cannabis and smoking weed. It's absolutely illegal, and what is needed is, I think, two things. One, the police have to know. So if there is a place that that's selling, that's where the Crime Stoppers are calling that. So that there's a level of awareness so that there can be some enforcement taken. And then the other thing is really teaching our young people, because cannabis is now legal. There's a misperception that it is, safe for everybody, and it's certainly tobacco is legal, but it's not safe for everybody. And so what kinds of education we need to do in school, I think, is something that we need to look into. But certainly there are a lot of illegal weed shops as well that we've been really pushing to crack down on. And again, the community has to indicate, like, this is happening here, so that the regular enforcement can happen. But it's scary.
Absent news, Sandy.
Okay.
Good question. And I appreciate that, because oftentimes they feel that others don't pay attention to those factors. That this is very dangerous work for these men and women. They're working in the most dangerous precincts. And they have access and they have touch points with sometimes the most dangerous individuals of those communities. And so they should be, lifted up. They should be prioritized as it relates to make sure that their well-being. And again, we have in charge a number of organizations that oversee the crisis management system or the cure violence rollout. And those organizations all have committed to make sure that they not just hire these individuals, but they literally look into these individuals and create, risk reduction plans for them as well. And so there's a lot of unconventional therapeutic services that are as part of the crisis management system that they take advantage of. There's a lot of counseling, professional mental health counseling that they also undergo and have opportunity to take advantage of. And so a lot of them now are really, they're taking advantage of these services themselves so that they are better to go back out into the communities that they work within to be effective. So it's very important that you raise that up. Thank you.
White,
Hi. Yeah, thank you both of you all for this task force. So this is a little bit of a different question. As we're pulling this information together, this is great, digging into this, but I'd like to go a little bit deeper. Are these data sets available for us as reporters, borough by borough, so that we can kind of look at them and examine what's happening with boroughs themselves? And would you all be available if they were for a deeper dive? And the third part of this question, as we're talking about stakeholders and as we're talking about investments and disinvestments as reporters ourselves, how would you like for us to be looking at our communities and covering the communities in terms of the gun violence?
Those are all great questions. And yeah, the data sets are available. I think one of the things, you've just given me an idea, the team has probably already thought of this, is that we need to have a website for this work so that you can very easily kind of click on a precinct and see all the kind of baseline data, the indicators and progress as we go, so that will follow up with that. And I think, connected to the other part of your question, the storytelling, right? It is important, and AT mentioned this about, perception and how people feel about their community. You guys are the storytellers of your communities. And so as we go on this journey, I think how the story is told, how community members, how the stakeholders in this initiative tell the story is going to be something that's going to be really important and really changing the narrative as well. Because I think, what we are doing here is what we're saying out loud, which was said before, like these neighborhoods, it's not by accident
Right.
that they are the highest levels of gun violence in the city. And we need to tell that story. And it's not just about enforcement, and let's just, as Mayor says, it's not just about enforcement, let's just go lock people up. Let's actually make sure that there's access to opportunity. And so that's a part of the story that needs to be told. There is a correlation between access to opportunity and public safety. And I think that'll be really important as part of this work as we move forward.
The overwhelming majority of these communities are law-abiding, tax-paying, God-fearing, church-going worshipers. The overwhelming majority. There's only, unfortunately, a minority of people who go, that want to commit crime. And unfortunately, that needs to be raised up. We need to get away from looking at the minority and focusing on the minority and put more attention towards the majority. I am a former chair of Community Board 5 in East New York. And our sole goal was to change the perception that people had of East New York. This was a community that once no one wanted to live. No one wanted to work within. And we worked in the last 20 years to turn that narrative around. Now it is one of the most sought out communities in all of the city, one of the most affordable places for folks to live. And so we want people to tell the real story of the indigenous people of those communities that have been there for decades, that have worked there, have bought homes there and raised their children and grandchildren, and that most people that live out there are not criminals. We spend a lot of time, even with our police officers, to let them understand that concept. That everybody that is walking around, while black male mostly, are not perps. that in fact they are residents of the community and have every right to enjoy every part of its community. And I believe that's also part of our strategy. If you look at community and police relations, we look to want to work to improve that as well. So I agree, that we should also always uplift and elevate the majority, of the communities are beautiful neighborhoods where beautiful people live and raise their families.
We're gonna coordinate with the data.
Mhm.
Roosevelt Islander, Rick?
Hi, I was wondering if you could describe how the crisis management system works within the context of preventing violence in the mental health arena. So, for instance, last Friday, there was an incident on Roosevelt Island where Roosevelt Island is a relatively safe neighborhood,
Mm-hmm.
just to start that off with. But a family made multiple 911 calls regarding one of their own family members who was threatening violence against the family. The police responded with 4 officers. They entered the building. 3 of the officers went up in an elevator to the apartment. 1 officer stayed in the lobby to prop open the door for other officers to come. As the officers were going up the escalator, the elevator, the other elevator opened up, and the person with a mental health issue came out with it wasn't a gun, but it was a very, very large knife. Could easily have been a gun. He charged the officer in the lobby. The officer retreated, but at the same moment, the elevator opened up, and 3 officers were in there. The person, not quite sure exactly what happened, but the person approached them, the officers, and the officers shot and killed the person. Is there any kind of system that's set up where maybe some kind of mental health professional would have accompanied the police officers to address this situation?
Yeah.
Just wondering if you have any comment on that.
So that is definitely one of the things that we're expanding. It's a program called Be Heard, and it's about behavioral health. That there are trained professionals that would go with sometimes instead of, sometimes with the police to try to de-escalate the situation and get the person who is having a mental health crisis in care. And that is something that we really invested in since we've been in office in the past 18 months and definitely want to expand. I think sometimes part of the challenge, and in that incident in particular, that person, as you said, was threatening the family with violence. And so they called the police. It is a tragedy. It's a very tragic situation, but that is a part of the plan, that those interventions will also be focused in these neighborhoods, because these neighborhoods do see a significant amount of mental health issues and people who can be violent as a part of their mental health.
Does every precinct have this?
Not yet, but that's what we're rolling out now. That's the goal.
Caribbean American Weekly.
Hi, thank you so much. So I just want to know, how do you plan to execute to move from the glossy paper to action and measure the success impact of this?
Okay, as been mentioned, we intend to evaluate our work pretty much daily. As we begin to move out in phases, the KPIs that I mentioned inside the safety plan is those areas that we're going to focus on and measure. And again, there's neighborhood safety alliances within each of these precincts that will also monitor these things and be frequently involved with the community and the police and other stakeholders to see how well the plan is working or not. And in fact, if it's changes that need to be made, then those alliances we will have those conversations about how do we make it better. We want to make sure that we are as closest to making these plans work in each of these communities as best as possible. But that's going to be something on a more of a daily basis, and as each phase begins to go into effect.
So there's an operational plan that's in place, an infrastructure staff that's going to be managing the execution of the plan, And as AT said, we'll be monitoring it every day.
For the nearest, Mohammed, you have it?
My question is, when you talk about 6 and 24, 6 means 6 precincts or 6 neighborhoods?
6 precincts. So each precinct has several neighborhoods, as you can imagine.
So you're talking about $500 million funds that will be spent in the years to come. So can you give us some details how you intend to spend those funds? And second concern of the community is the availability and possession of illegal guns. Are you people going to address that concern too during your task force duties?
Absolutely. Well, the second part of your question, the NYPD is, I mean, has taken more guns off the street, I think, ever than ever. And so I forget what the number is. I think it's like 7,000 or something like that. No, but we'll get through that number. But it's the highest ever. So there's a rigorous operation to get illegal guns off the street. Obviously, no guns are made in New York, but they make their way here. And so there's that iron pipeline where they're coming up through the South, where the Attorney General Tish James and other lawmakers are very involved in stopping that. But it's just, I mean, there's just an overabundance of guns on the street. And the NYPD is doing everything they can do, as well as engaging with community organizations, doing gun buybacks, like all of the things. So it's a goal, it's a priority, but it's a real challenge and something that we obviously need. Gun reform, there's many things that we need there. And just to give a little bit of a breakdown on the resources, I've looked at my little cheat sheet. In terms of programs that are focused on employment and entrepreneurship, it's about $120 million. So things like money for young people who are not in school and not at work, but to get them connected to jobs, including SYP, year-round internships. So those are some of the resources in there. In terms of community vitality, so things like our community centers, parks and playgrounds, all of those things. Some of those funds, about $190 million for the community centers and playgrounds and things like that. So there's the total funding there for about $200 million. Resources to go really upstream with school-age children. There's about $120 million there. So that includes things like Project Pivot, which is something that I'll let AT talk a little bit about. For CUNY students, beacon programs, teaching young people, making sure they know how to read, all of those things. And housing, we've got about $57, $58 million of expense funding. Then there's a lot more money in capital. That's a much bigger number. And then trauma-informed care is about $100 million. So that's some of the behavioral health stuff that we talked about. Mental health for young people, substance abuse treatment for people who are currently in custody that are going to be coming home. So those are some of the things that are a part of the blueprint.
And if I can just add, I'm sorry, that our emphasis is on prevention. The mayor said over and over again that by the time a young person gets a gun in his hand, it's almost too late. And we would agree that the accessibility to firearms in our community is overwhelming. But again, our partners in law enforcement are doing their very best to remove as many guns off the street as possible. Our efforts is in how do we prevent the young person from ever having to choose to obtain a gun. And so we want to really be laser focused on precision resourcing versus precision policing, right? And making sure that the individuals who are more likely to gain access to a gun in these neighborhoods are given opportunities that they've never had offered to them in the past. We believe that that is a game changer. If in fact young people have options in front of them that are more worthwhile, more fulfilling, more promising, they will take advantage of these opportunities versus a negative opportunity. But we have to make these opportunities available. So that's why in Project Pivot, for example, that is mentioned, we're going into the schools inside these same neighborhoods. That's our early intervention strategy. And we're working with the kids that the schools are telling us that are problematic and having rough days and times, maybe absenteeism, all of those things are things that we're looking at. And we are applying, we're getting mentors to be working with these young people and their families. And then we're also creating safe corridors for these young people so that they don't have to fear going to and fro from school because they know that there are people who are working to make sure that that pathway is cleared for them so that they can focus more on their education. That's really what this community safety plan is about, and I think it addresses those issues when it relates to the gun, accessibility.
We have the last two questions. Cinta Daily, Samantha.
Great.
Okay, great. Thank you. So, the Indian Eye, Sunil Halil. Here. Oh,
Yes.
We have advice leaders really happy to give you ideas and calling them.
Absolutely.
Being that is the door, but that's
Wonderful.
thank you.
Thank you
for
so
that.
much.
Thank you for that. So the last one, we go to the village son, Lincoln Anderson.
Okay,
Right there. Okay.
I guess I kind of have two questions, but you've been answering a lot about crisis management system does. I guess I was going to say, I guess there's different types of crisis management. What is a typical day of a crisis management system or overall? And then, I don't know if this is a good question. Air Canvas is the same line, goes back to family. We have to use very serious solutions in that project. And Air Canvas said, sometimes the parents need to get involved too. And I'm seeing the crisis management system, not only identifies the use of schools, but it also goes to families. I guess I want a little more to flesh out the picture, but I know it's a large program in a lot of areas,
So the core of the crisis management system is the Cure Violence Global Model, right? The Cure Violence Global Model is the core of the crisis management system. And that's where those violence interrupters and outreach source workers and hospital responders, their job is very, very important. Their job is to stop the bleeding. First and foremost, we have to stop the bleeding. We have to stop the gun shooting. And so at first they go in and they do that very critical work of making, their communities safe. And then the wraparound services that you talk about is those things that we're able to apply, not just to the individuals that we work in our caseload, but with their families, right? Because as you mentioned, it's important if you really want to help a young person out, you have to assist them in their family needs. Because most of them, if you get to know them, they'll tell you that's the reason why they're out there in the first place, right? Because they're out there trying to help provide for their families. And so when you look at the work that the crisis management system does at its core, laser focus, first we got to stop the bleedings. We have to bring down shootings and their homicides. Again, that's something that we track daily. And once we're able to maintain days of peace, we're able to apply the wraparound services and all of the resources that not only that individual, but that individual's family's needs are met. And that's what I love about the 7 strategies. We have benefits. We're focusing on how well they are able to, family members are able to take advantage of some of the benefits programs that we have in the city. We're talking about the trauma-informed care. Back to your point, one of the things that we heard mentioned over and over from our community convenience and town halls is how traumatized a lot of these members of the community and their families feel. Victims of violence and families of unfortunately who've lost their family members to violence. We are providing meaningful services for them as well. And being able to, the employment and entrepreneurship portion of this plan, it's not just for those individuals that we are looking to reach, but them and the members of their family. Any individual within those precincts that can take advantage of these resources, we're looking to get them engaged so that they too can be able to be serviced as well.
And if I could maybe just give a couple of examples, like you said, real life examples. So AT mentioned the hospital violence interruption. Say someone is shot and they're in the hospital. Someone from the crisis management system will go to the hospital, and they are known in that community. So they more than likely they know the victim and they know the shooter. And what often happens is retaliation. So if somebody gets shot, like they're planning on who they're going to shoot next. So that interrupter is literally at the hospital saying, listen, we got to stop this beef. Let's figure out what we need to do. Let's, if the family needs to be moved to be safe, if there's other resources that that family needs, be counseling, healthcare services, that person, that crisis management, that violence interrupter is an advocate. They're engaging with the other people who did the shooting to try to change their path and trajectory, and deploying all the resources of this plan to get them up. So they're like they stand in the gap when, you know, a lot of this stuff happens over social media, right? People are threatening each other. They're monitoring social media daily. They understand like who has a beef with who, and they're really engaging in those mediation and conflict resolution on a daily basis. And that's what I think one of your colleagues was saying. It's very draining work. It's very risky work, but it stops so many more shootings and deaths that you're not going to hear about, because they are doing that really critical work. And what we're saying now is what A.T. said is, in addition to, it's almost like the fire men and women that go to the fire, like it's not just putting out the fire, you have to put out the fire, but it's also about making sure that people, before they even get there, have what they need. And so we want to give those individuals who are the most trusted people in the community, in those community groups, and those people who are gang involved and justice involved, they're the most trusted people. They're the ones that can connect them to services, supports, interventions, opportunities way before they're going to get into that gunplay. And so that's what we're trying to make sure, that they have all of those things at their disposal. It is. No, it's happening. A lot of this stuff is happening right now. So just to be clear, but we are bringing it all together and really focusing it on these 6 neighborhoods to start, as opposed to scattered. You know, some stuff is happening here, but not here. Some stuff is happening there, but not there. This is going to be a really focused, concentrated body of work with some new stuff in it in these neighborhoods and communities.
Any closing remarks?
Well, thank you. Thank you. Really appreciate everything.
Mohsin, Zaheer, Urdu News, New York.
Don't forget to like, comment and subscribe.